So my name is Kristen Boggs. I'm the Executive Director of the Alabama chapter of the Albert Schweitzer Fellowship. We've been in existence since 2015 as a part of a national network of Schweitzer Fellowships. And our mission is really to equip graduate and professional school students to have both skills, but also a commitment to working with vulnerable populations after they graduate. And we do that through a one-year fellowship experience.
And I applied for this fellowship at the end of my first year, so I participated during my second year of medical school.
So while they're still in graduate school, in the midst of all of their academic commitments, they also commit to spending 200 hours to identify an unmet need and then plan a project with a community-based organization that's trying to meet that need.
So I paired with the UAB's House Calls program, which is a program through UAB Geriatrics that does house calls for medical needs for homebound seniors in the Birmingham community.
Research also shows that a sense of social connectedness is oftentimes tied to loneliness, and that loneliness is tied to poor health.
So we paired with them and created what we called the Senior Companion Program, which was a volunteer program where medical students could go visit these homebound or bedbound seniors in their homes and purely have just social visits with them. So they're already getting their house calls visits and getting their medical needs met, but these people were still kind of just like hanging out at home by themselves or maybe with their caretaker.
I was introduced to this topic because I heard this story about how social isolation was as bad on your health as smoking 15 cigarettes a day. And that just blew me away. It's like, what? I mean, we hear so much, in the public health arena. And I think I, grew up and other generations have now grown up knowing that smoking is bad for your health. And yet we don't have kind of a public understanding of social isolation as being bad for your health.
It's important because sometimes a lot of these, like the big healthcare centers or the big public health centers, are more in urban areas. And like Kristen said, I'm doing family medicine and plan to practice in rural Alabama and do rural medicine. And so sometimes there can be maybe just not a realization of how drastically different it can be between like Birmingham and then the Black Belt counties of Alabama and the experience people are having.
In the state of Alabama, all 67 of our counties either have a health professional shortage area or a medically underserved population.
Something we learned a lot during our Albert Schweitzer year was about when you're going into communities or to serve that community, you don't just go in with your idea of this is what I can give you, this is what I know you need. You go in and try to see what the community needs from you.
Another thing that makes Carson unique is that she is interested in serving in those rural communities and has made an effort to seek out opportunities while in medical school, and is going to do a family medicine rotation. So I just think that's kind of part of the bigger context of all of this too, is for us to think about how do things like COVID or how do things like social isolation play out uniquely in our state.
Think about someone you know in your life who might be homebound, maybe not completely homebound, but still spends a lot more time at home than they used to. And their life kind of becomes this like shuffling between their bedroom and their kitchen and their living room, just like watching their TV, watching their shows, watching their Westerns or their soap operas. And that's what their life becomes. It's like these three rooms. So just have an opportunity to have someone to like come in and let them talk about themselves or let them do something that they want to do, or to even give them some connection to the outside world. And so you could see just visiting with the seniors how they look forward to these visits.
I was looking at the Alabama Civic Health Index because I remember that there had been a fact in there that again was just kind of staggering, kind of like that, social isolation being the equivalent of 15 cigarettes a day. And it was that in 2013, the civic participation rate in Alabama, specifically for working with neighbors to fix something in the community, we were ranked 51st, and that we only had 4.7% of respondents who said that they did that. So I just think that's, again, just a nice way to tie back into this conversation, to think about maybe the bright side of things is that this may encourage us to think about not just how we're protecting ourselves, but how can we reach out to our neighbors and do something collectively with them to look out for each other.
feel really strange to just not have any of the ceremonial aspects of finishing medical school and to just kind of glide into, okay, here's your first day as a real doctor and just start. But it's part of it, you know, it's also kind of what we signed up for.